We're Team Colon Care, and our project is to increase procedural compliance to getting a colonoscopy. We're sponsored by Renee Taylor and Jason Lee, and these are our responsibilities.
Okay, I'm going to be in charge of message protocol and creation, the messages that will be delivered via the avatar.
Hi, I'm Bing. I'm from Rehabilitation Science, so I'm responsible for instruction and educational component.
I'm Matt. I'm working on the metadata storage, the application skeleton, functionality, reward system, and synchronizing the calendar.
I'm Mariah, and I'm in charge of the survey development and integration with the app, and also helping with graphics.
Hello, I'm Thomas. I'm going to be in charge of the avatar creation and customization, as well as the graphics for the user interface with the Android application.
And I'm Alex, and I'm in charge of organizing and managing the compliance data, and also working on the reward system.
Okay, first let me introduce the colonoscopy first. Colonoscopy is an endoscopic examination with a camera on a flexible tube pass through the anus. It can remove polyps or neoplasm for a biopsy to examine whether it's benign or malignant. So it can be used to diagnose colon cancer, or it can be used to diagnose inflammatory bowel disease. And colonoscopy has become a routine examination for people in the United States who are over 50 years old.
And so of people who are referred to colonoscopies, only about 50% actually end up completing the procedures. And overwhelmingly, that's actually because of scheduling issues or non-compliance. And there's some demographic variables that predicted, but in general, and you can see them up there, but in general, patients report issues in three broad categories, which are cognitive emotional factors like fear of feeling uncomfortable, not thinking that it relates to them because they don't have symptoms, disagreeable preparation, so it's a pretty disgusting process, or fears of finding cancer, logistical issues like transportation and busyness, and health system factors like scheduling challenges, and patients being unaware of their responsibilities. So with this app, we're really trying to address all of these common barriers that have been found. And in general, what we've learned from the research is that an education component is critical for patients to really understand why it's important to them, even if they're not feeling symptoms. Patients' feelings of fear and discomfort need to be addressed in a warm and comforting way, because there is a lot of embarrassment and discomfort associated, and you're really trying to lower that. Compliance monitoring applications in general need to be, well, especially for this, need to be discreet and private, so you can't have it popping up and going like, hey, you have a colonoscopy announcement, in a meeting or something. So you have to be discreet about it. Transportation issues, especially with the elderly, need to be addressed. So organizing rides, stuff like that. And final scheduling issues should be handled automatically, just to really reduce the most common barriers that are associated with non-compliance.
Okay, and so the technology aspect of this draws on literature from mHealth or mobile health, and some of the advantages of sending health messages, compliance messages via mobile devices have to do with the ability of two-way interaction between patient and doctor, as well as asynchronous and synchronous communication. The mobile phone is a very personal technology that we have an affinity for. We love our mobile phones. Fogg talked about this. In addition, familiarity with the technology. We are not going to assume that people know how to use the technology. We will educate them on this. But many people are familiar with the mobile phone as a device, and they will be given the mobile phone well ahead of time before when they have to use the app to become familiar with it. In addition, mobile phones, particularly smartphones that we're using here, have the capability of delivering multimedia messages. And just to speak really quickly about our demographic, we are targeting the African American community, particularly a community members of a lower socioeconomic demographic. And so research by the Pew Internet and American Life Project, which is a research organization that looks at how people use technology, have found that African Americans have the highest adoption of rate of mobile phones at 87%. 44% own a smartphone. In our case, we will be supplying the smartphone. They also have the highest use of health apps. And with this population, our target demographic typically has a low literacy rate for reading comprehension as well as a low health literacy rate. And research has found that health messages delivered via audio and a visual component are more effective, and so that's what we'll be taking advantage of.
So about a month prior to their colonoscopy, subjects are going to get a Samsung Galaxy smartphone, and up until like a day before their procedure starts, so between that month and 8 days, they're going to have to take this preliminary survey. And the goals of the survey, which is integrated into the app of the smartphone, is to first off establish what communication preference they like. And so we'll go through that, as you guys might remember from last time. Also to establish what status they have and their socio-demographic preference, so that way we can tailor the messages to what they're used to hearing or how they're used to interacting. Also to establish some preliminary characteristics so that they can create, so that we could start off with an avatar of who they might want to respond to, and also gather extraneous data about the subject. So things like what medication they're taking, how often they like to be reminded, what time of day they take those medications. So the survey is going to look something like this, where they're going to get a series of 19 questions where they have to answer on a scale between never and always what interactions they like to have with their healthcare provider. And this will allow us to break them up into 3 distinct modes of communication.
Okay, and so these are the communication preferences. These are based on our sponsor Renee Taylor's model. And so there's 3 different preferences. There's collaborating, encouraging, and instructing. And each person will only have one preference throughout the entire application. And so the collaborating preference looks at empowerment through questions, so a questioning tone of voice with the avatar. For example, what are your plans for picking up your prescription? The encouraging preference is a positive and hopeful reinforcement, or a cheerful tone of voice. So the example message would be, if you pick up your prescription in advance, you won't have to worry about it on preparation day. And last but not least, there's the instructing style. And this is more of an authoritative or firm tone of voice. For example, it is important to pick up your prescription.
So then the other 3 aspects of the preliminary survey are the sociodemographic status. They'll get to choose which one they prefer, or who they relate to. And then also through a series of pictures, we'll let them sort of sort through some characteristics of an avatar, so we can hone in on maybe something that's an initial avatar. And so these are different pictures of healthcare professionals, but also maybe include pictures of family members or other people their age. And then finally, we can ask them, what types of medicine they want through, really strong visuals. So that way, we know if they're taking Tylenol every night, we can make sure they get a message not to take Tylenol, because that will ruin their preparation for the colonoscopy.
All right, so that moves into avatar creation. So the surveys that we were just talking about, that's used for the initial characteristics of the avatar, so that they get, instead of just the base avatar being the same for every single person, it can be already sort of tailored towards the individual based on these surveys. And as the surveys kind of pointed out, they're more tailored to who do you respond best to, rather than what are you. So not the avatar won't necessarily be someone that mimics your own looks, but more who you respond best to, who you're most likely to listen to. However, from those initial characteristics that the surveys give you, we're also allowing the users to tweak anything that they would like to, so that they can modify it till it becomes something that they enjoy and find pleasant. Because we're not going to say that the survey can perfectly identify, what they like to look at and who they like to communicate with. However, for the scope of this, we limit it to the number of things that can be changed. The first thing is language. However, we're only going to focus on English for this project, but in the future it would be good to be able to reach more people by letting language be English or Spanish or whatever the person might speak. Being able to change the gender, here there's two options, male and female. The tone of voice, which follows the communication preferences from the surveys. So that will be the cheerful, the instructive, or the questioning tones of voice. The skin tone, which has an infinite number of choices, varying from light to dark skinned. The age, something pretty basic, just putting in wrinkles or no wrinkles, or maybe the amount of wrinkles, just a couple different levels. Nothing too extreme there. Also the hair, being able to change the color and the length, and the body type, both height and weight. So we're just limiting it to a few characteristics to really define the avatar. And this will result in more of a non-realistic kind of me-like avatar rather than a photorealistic avatar that you can see in some newer video games or what Jason has created.
Could you also add, just as an addition, just clothing color?
Yes. Yeah.
Throw in. It's easy to do that.
Yep.
What about dialect?
So in the what we are going to do in the messages, we are going to first of all create messages that are appropriate for the literacy level. In addition, we are going to audio record the messages, and so we are going to audio record the messages. We are going to have African American voices, because a lot of times these don't necessarily come down to the words being used, but the paralinguistic. So how things are pronounced, the tone of voice, and so that's how we're going to address that.
Yeah, so in the future, there would definitely be more things with the tones of voice, but for the scope of this project, we are just focusing on the African American demographic. So we're just going to be recording that to be culturally sensitive and in that, style.
And Dr. Taylor, once they have chosen a tone, she wants them to stick with a tone. So that will stay consistent throughout.
All right, so why are we creating this avatar? So this is what the avatar will be used for. The first thing is it'll actually talk to the patient. So this moves beyond just getting text-based information where the patient reads it based on the use of visuals and audio to enhance understanding and motivation. So this is for two parts: the education, so people understand better what they are supposed to be doing and why it's important, as well as motivation. So a lot of the stuff in the preparation procedure is difficult, and people tend to give up through the process, and having the avatar constantly there when they need it will help be a motivating factor. One of the ways we're going to do that is that it will mimic the patient's responsibilities. For example, one of the toughest things is they have to drink a gallon of solution in 2 hours, which is pretty bad. Number one, it doesn't taste the best, but number two, that volume in that short of time is extremely uncomfortable. So our idea was just to have the avatar there drinking the solution out of a jug, and the jug is emptying, just to give you an idea. Okay, you're almost there. You've only got a quarter of your tank left. Just keep going. I know you're not feeling so great, but you're almost there. And then the other thing is we don't want the avatar to be annoying, so it only appears when the patient wants to interact with the avatar. So the first thing that happens is a text-based push notification comes up on the mobile device, and the user can either say, dismiss, I don't want to, I don't have time to interact, or I'm with a group of coworkers and this is embarrassing, I don't want to interact with my colonoscopy avatar right now. Or they can select, yes, take me to the avatar, and then they can interact.
And one of the other functionalities of the app is that it'll synchronize with the calendar so that the user can actually go into the calendar and see the different milestones they need to complete on the different days before the colonoscopy. And when they need to complete an actual milestone, a text message reminder will pop up, allowing the user to either go to the avatar to receive the message, to snooze it so that they can delay it till later and they can go to the avatar later if they're busy at the time, or to dismiss it completely and not receive the message at all.
Anyone also guard against accidentally pushing the wrong button? Like if they hit the dismiss and it didn't intend it, just add a little bit of, are you sure?
Another functionality of the app would be data collection. So we would keep track of the actual app usage, the pop-up responses, if the user dismisses the reminders, if they delay it, or if they go straight to the avatar, the amount of time they spend with the avatar, how many milestones they complete, and the completion of daily surveys that would be used to check to see if they did what they were supposed to do on those specific days. Those surveys are to see if the patient is actually following the program and to track how they're doing.
I have a question. Do you think that the fact that the people know they're being tracked will cause them to be more diligent in performing these duties?
Hopefully, because also at the end of the program, the doctor will receive a spreadsheet of everything that they did. So it'll show what milestones they completed and when they did it. So that might be an extra motivation.
But it also could be a contamination to human augmentics. So if you had somebody just calling them and saying, not calling them, but if there was just monitoring, the fact that you're monitoring them can also cause them to change their behavior and become more compliant. Versus what's the use of the avatar? So if you had no avatars and all you were going to do was to collect data on what they did, is that any different?
In her grant, she has a placebo of people that just receive the smartphones and are allowed to freely interact with it. So I guess another thing would be having another control where they have a phone and a calendar sync, but no avatar.
Okay.
I think that's what the control is. What they do.
They have a calendar.
Yeah, she does have that.
Yeah.
Okay.
Okay, so at the end of the program, there'll be an administrative backdoor so that the doctor can actually log into the phone and get the spreadsheet, like I said. And a future goal would be server synchronization so that the information of their compliance will be uploaded onto a server so the doctor can check it in real time.
And so definitely one of the important things with the compliance data and the device usage data is you can really see the way it'll be organized is it'll enable physicians to see not just, are people complying, but like where is compliance falling off? Where are people, getting off the bandwagon? And additionally, physicians will be provided with a final report, hopefully at the end of it, where they can just see, for each person, what was their general, compliance report? How did that person do? And maybe that could be used to inform decisions, post following the guidelines, pre-procedure, so they know, okay, this person, took Advil, for 5 days. We shouldn't even bother starting the procedure because, they're probably not gonna, if they have inflammatory bowel disease, it won't even appear because they've been taking these anti-inflammatory drugs for 5 days. So we should wait and do it again later.
So as part of the data collection, we will also have a reward system. So the patients will receive different achievements for compliance with the milestones. So they are rewarded for the different steps that they go through to complete their colonoscopy prep. There will also be compliance-based adjustments. So if the patient is not actually completing their milestones and not following the program, a response would be to have more frequent reminders and more frequent pop-ups to help remind them to follow the program properly.
Also, colonoscopy is a routine examination. The preparation is still tough. They are told not to take certain medication like anti-inflammatory medication, and they are told to have some solutions in 2 hours. So just because they don't want to get the exam result to be blurred or confused, so they will get the program a week before, so they have time to do a preliminary survey from day 7 to day 3, no, to day 4.
Yeah.
To day 4, and they have to interact with the program, and at the end of the day, they'll get some question that did you take such a medication like Advil or something like that, and from day 3 to day 3, they'll get a pop-up notification that to remind them to pick up the prescription, and at day 2 and day 1, they'll have to prepare the solution and drink them in. At day 1, they'll drink 1 gallon in 2 to 3 hours. So if they are successful for preparation, they'll get that thing.
And like we were talking about before, some of the big barriers like transportation and final scheduling will hopefully be handled automatically. So they'll have the ability to put in a specific contact information, and then it'll automatically text the person hey, do you remember you're driving blah 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 to their colonoscopy on this certain day, and maybe contact the physician or the office and say this person's on track, we're on set for the final scheduled colonoscopy. So some of those major barriers to compliance will hopefully be handled automatically.
So did Renee by any chance have any data about what percentage all these different barriers will contribute to the overall problem? So can you prioritize, is it the drinking of the solution that's the worst, that's number 1, and then the scheduling number 2?
So I had a slide on it that I didn't put in. But so the major factor are the final scheduling, and with older adults is the transportation. So those are the really 2 big issues. And final scheduling should be handled with their initial appointment, because they'll get the smartphone and that final schedule is programmed into their phone. And the transportation is the major thing that we can do in the app, which is enabling them to enter the contact information and have it automatically contact the person. But after that, the big barriers are educational. So educational and embarrassment, actually. So the educational things like, I don't have symptoms, why do I need this colonoscopy, is a major oversight among patients referred for colonoscopies, because very often there aren't, and correct me if I'm wrong, there aren't symptoms even when you're at the stage where it's reached colorectal cancer. There aren't symptoms of pain and discomfort until after you're at that phase. So ideally, we don't want to force the educational materials on them, but they'll always have the ability to say more info and get some of that educational stuff.
All right, so this is just kind of our entire project overview timeline. So on the left, we have our 4 main objectives, which are designing the communication, developing the Android application, creating the avatars, and collecting data. And then we've broken that into 20 different major tasks that we will complete throughout the semester. And on the right is who's in charge of it, or who will be working on it. And then in the middle, you see the timeline when we plan to complete it. So I guess I can just read through them. So our first thing was meeting with our sponsors. We did that. Our second thing was the project proposal. We're doing that right now. The next thing is completing the survey for communication and physical characteristics, creating a database for messages, creating a preliminary avatar, creating the structure for compliance messages. This is the how and the when. The structure for the content, so the notifications with the more information. providing educational information, detailing a reward system, which could be badges or medals or collecting points or something, creating a functional skeleton for the Android app, integrating the surveys into the application, completing the script that we will be using for our messages, integrating the survey with the initial avatar creation so we can automatically generate a preliminary avatar, implementing the reward system, recording the audio for the communication messages, completing all the application interfaces, deploying the full application, and then with 2 weeks before it's due, we will have time to test it and create our final project presentation and report.
How many of your programs are computer scientists?
Okay. I'll make sure you're not overcommitting yourself.
So can I nitpick two things? One is, can you go back to the survey where you had the always never?
We should add that the survey, we've been told we cannot change.
Really?
Yes.
Because this is very binary. It makes almost no sense to have a slider.
So we can she said also we can do 1 through 7, with 7 being always and 1 being never.
The way this survey works is whatever they're closest to, it'll just go to that extreme for that question.
Okay.
So, because,
Really?
Yeah.
Not some, oh, wow.
Yeah.
We've had
I
a
thought
lot.
that was
We've had a long
just
discussion about this.
Yeah.
I thought it was a scale, but I
I
guess
thought
I
it
was
was
wrong.
scale too.
And then the second thing is, when you have the pop-up, maybe I'm being too sensitive, but maybe it shouldn't say colonoscopy.
it's not going to. This is just a representation. It'll just, we are going to be very sensitive. This is just for slide representational
You could
purposes.
say your avatar has a message.
Yeah.
Yeah.
Or just a
Your
pic-
friend.
You just put a little,
Yeah.
you just put a little picture of the
Your happy
avatar in
friend.
there.
Yeah.
Yeah.
You
Yeah.
know.
Yeah, maybe message from a friend.
I have a message for you.
Yeah.
It's just to show how the pop-ups work
Yeah.
with the buttons.
Go ahead.
I had a couple of questions. So, what I'm unclear on, for the survey, does she already have IRB approval to conduct the survey? And who's actually going to be conducting that? Who's going to be interacting with the patients to get that information? So my first question is, does she have IRB approval for it already? And number 2, is her staff going to do that, or are you going to do that? Because
Yeah, we're not involved in that. We are not even testing this with patients. We are designing this, and that's, as far as IRB, I know in the document she has gone, states that she's seeking or has sought, there's IRB mentioned in the document.
Yeah.
I don't know where specifically she is with that, but we in no way are interacting.
I think the idea is that when they come to the initial appointment where they're referred for a colonoscopy, I'm guessing that the nursing staff is going to give them the device and guide them through the initial survey, because they have to put in, there's an administrative screen essentially when they open it up where they put in like an ID number and the date and time for the final colonoscopy, and then guide them through the preliminary survey. And once they go through the preliminary survey, it goes into essentially user mode.
so if you go to your beautiful timeline, that last slide,
Yeah, so it would be before day 8.
so what you're saying is that the administration of the survey, all of that, the nurse is going to do, actually the next one? Yeah, this one. I love your organization here. It's nice, your task, your project completed by, who's doing it. So then, are you saying that you are going to be getting the information from the survey, and then you'll be able to kind of do the next steps? So you won't be interacting with the patient, but you'll be doing this kind of stuff.
Yeah, we'll be so we'll have it literally run on a phone for a week to see how it pops up, and if you want to speak to that.
Yeah, so the survey itself is conducted on the phone, so no one ever really sees the results. It's just stored in the phone internally. Right. And then, because
Go ahead.
Yeah, the survey, they get the phone a month before the preparation, or before the procedure, but they don't actually start using the application until 8 days before it. So that they kind of have that time in between to get familiar with the phone, and then they have the survey there. So yeah, no one's really interacting with it on our end or really the doctor's end. It's just kind of internal and personal to the person in the phone.
These guys are only doing technology development, and then when it says deploy and test, what that means is that the guinea pigs are going to be themselves or students in this class. So they're not going to really engage with students. The reason is Renee has, like us, when we wrote the CCTS internal proposal, she has written an internal proposal to UIC.
Okay.
So until that succeeds, she won't really start the project, right? So this is to help her so that if that fails or she finds another grant opportunity, we know more about how to write the grant.
Okay, so all of this is not done on real patients.
None of
this
this
is
is
all
patients.
going to be done. So when you say deploy full application,
That means it's installed on the phone as a complete
This is what we
application.
wish we could have done with the asthma one too, but we didn't have time. Right? So build an early prototype so we could play with it and break it and get an understanding of all the different trade-offs, and then know more. Usually when you write a grant proposal, you already sort of know quite a bit about what you're doing. Right? And so Renee will, if she succeeds with the internal proposal, then she will go and apply for the IRB and find her subjects and so forth.
So then, just to make sure I understand this, so when you say deploy full application, et cetera, who's going to be the person that's actually going to have the phone a month in advance and take the survey in 8 days and do all the other stuff? Who's going to be...
I mean, in the future, ideally...
No. Like for your...
Well, we wouldn't
This-
have it for a month in
yeah.
advance, but we would start it, on the 8th day, and then just test it from that point on.
Giselle, is your concern that maybe we should have someone within the African American community that will be served by this tested? Is that what you're getting at, or
What I'm getting at, what I'm trying to understand, how close you are to doing the real thing.
okay?
So I understand that there's testing the technology, because just to get the technology to work is an amazing feat. Just that is huge. So what I'm trying to see, if one of you, I'm not saying you're going to have a colonoscopy, and I'm not saying you're going to drink, the Go Lightly and all that stuff. I'm just saying if one of you were actually kind of, is someone going to be going through the process of getting the phone and receiving the reminders, seeing if the technology works, creating the avatar, just kind of going through the
That's what we mean by
Yeah,
That's what we mean by.
We haven't decided who yet, though. But
Yeah.
one
Who's
of
the
us,
lucky one,
one of
right?
us will do it.
We won't necessarily be going through all of the things like giving up medications because we're not preparing for a colonoscopy. So if we need an Advil, we might take it.
Yeah.
Just
But
pretend.
Like, no.
but we will do all the interactions with the device as if we were going through the preparation steps to see how the technology interacts. If it's annoying, if it's embarrassing, if it's totally lame and not something that anyone would want to interact with. If it's
And ideally, we'd have multiple people doing it so that one person could be completely compliant. Another person testing it would maybe not complete all the milestones, or
To see if the person that's this is another pet peeve of mine. The real correct terminology is adherence, because compliance is very paternalistic. You have corporate compliance. Adherence is more the patient doing what they think, Adherence is the patient doing what the prescribed treatment is. Compliance or corporate compliance is more like a big brother looking down on you. So it would be very nice, because if you have an adherent person and you see how it works, and if you have a non-adherent person, you want to see, do they keep getting the reminders and the avatar messages and all that stuff.
You could also simulate this amongst yourself in the sense you don't have to drink that stuff, but you can imagine you have to drink just a gallon of water or something as the substance.
Yeah, and I will. I'm not shy. I've actually been through the process.
Okay.
So I'm bringing that knowledge of the process in. Like, so, that final day, you're not walking around, right? You're at home, right? Within like 2 feet of your bathroom. And that's why I actually posted, for those of you who are interested in this, I posed Dave Barry, a humor columnist, talks about this process. So so I'm trying to bring in my knowledge of going through this process. I'm a little bit different. I mean, we're completely different demographic, completely different reasons, but, and so, so we do have someone who's, this is not us just imagining things.
And I encourage you to also speak with Renee about, ideas for maybe she may have a few people who could help test this. But I think bear in mind that your application will break a lot during the testing phase. So I wouldn't say deploy full application because you're not really deploying the full application, you're deploying the prototype.
Right.
Okay.
Yeah.
And then the other question I had was actually going back to Renee's model, and this is probably a question better answered by Renee. I'll go back.
Are you talking about her?
Her 3 different
communication styles.
Yeah, and maybe I don't know. Maybe Steve has a better feel for how communication works. But I have this nagging feeling that most people end up for different types of messages wanting different ones of these at certain times. Because some of them are going to be really important. And you want to be instructing, or they're not going to.
Yeah, and this is, so one of my, there's different ways you could do this. You can keep with one or change messages as they go. And I can take this up with Renee again, because we also have to think about what style the educational messages are in, so that we're not throwing in a completely different style, because any message you have has a style and a tone. And you're right in that they may need to change, but I think for her testing purposes, she wants them static. But I can speak with her again about that. But I think your observation is valid.
I think this is specific to her research protocol.
Yes.
She wants people to lock into
Yes.
a communication style and maintain that style for the duration of
This is her model, and she's trying to test
And that
it.
came up during her presentation. I asked her about that too.
Right, because the other thing,
Rather unrealistic.
Okay.
Yes.
Okay.
the other thing, just quick, that she said was, for like version 1, have it locked in, but maybe in the future let them have some flow. But they want to have the preliminary results or some findings based on it being locked in first.
Yeah, and this is Dr. Lali Abril. She's from the communication. She does health communication. She's pretty awesome. Yes, Lali.
Thanks. I just have a question about, I don't think I understood how these classifications come from. Do they come from the previous question in which that line either converges to one side or the other? So how does the middle ground, when it's in the middle?
It'll go
To either side.
Yeah, it'll go to one of the sides. There's 19 questions, and if they mark, a little bit to the right, it'll go to the right.
So there are things like, I like people who are positive or something like that. And it doesn't ask them, do you like cheerful things? It's not that, it's more, here are some questions, and I'm not sure if she's taking those from the established styles, Bergman and Hale, and things like that.
Okay, so there is a middle ground that it can converge to, and this is one of 19 questions. Okay,
Yeah. So that's what it's in.
This is sort of what it
thank you.
but we're going to take it.
Okay.
Yeah.
I thought there were only 2. I thought there was either never or always. Those were the 2 choices you had,
For each question.
And
for
there is
each
middle-
question,
Yeah.
right?
But you can put the slider.
No, the slider doesn't make any difference. Right? In reality, you have basically
Yes,
2
yes.
forms. That's it. Doesn't make it, unless you put it all the way to the right or all the way to the left, it's going to give you yes.
Yeah, it's fine.
So it actually should be a button rather than a slider.
But if they
But
also
if there's a
pick
button.
never every time, then
Yeah, you don't want them to just,
Yeah.
be able to.
Yeah.
But there is a middle ground too, so it's not binary, it's 3 points.
No, it's binary. They only have 2 questions, 2 ways of
And
answering.
another thing, so
So like Lali, if you
It's
put
the
it in the middle,
average
it's
of
going
the
to shoot it
scale.
to one place
Okay,
or
so
the
each
other.
question is binary, but then the scale, and they have divided into 3
Yes.
zones. Okay.
speaking practically, I'm working right now on a project which also has sliders, and you want to make sure that they can't just hit next over and over again and it just be in the middle. So it's got to be something where they have to move something and then hit it. So it forces them to, actually think about it instead of just next.
Do you record what they actually put on the slider? Do you usually record the slider position?
Yeah, so yeah, you'll have to, well, bend
No,
it.
I know they have to do it, but do you record the slider position?
Yeah.
Do we
Yeah.
record the slider instead of just always or no?
Yeah,
Yeah.
so yeah, you need that value in order to code.
Okay.
Final.
The reason is because you can look at the population, people that are doing this, to see whether, you know, they're always on never or somewhere in the middle, to get some idea that if you had other ways of saying the same thing, that it would be useful, because these people would be interested in something other than the two extremes.
The first, yeah.
It's actually longer than that. That's just
Yeah.
like
So,
The first page.
so we're gonna try and pick up more of this later in the next
Yes.
class, because we're gonna run out of time for the next group. So thank you all very much. You guys did a great job.